Hi, I want to welcome everyone to our Tuesday talk with Dr. Bradley Trivax. Dr. Trivax, welcome to
Thank
Fertility
you.
Warriors. How are you?
Good to be here.
Well, thank you for being here tonight. First of all, I want to welcome you. This is going to be our first interview that will be on our new YouTube channel. So for our national audience, please tell me a little bit about yourself.
Sure. So I am double board certified in obstetrics and gynecology and reproductive endocrinology and infertility. I'm part of Stony Brook Medicine's Island Fertility. That's where I practice in Comac on Long Island. I've been really working in the field of infertility for about 15 years. Um, and I'm really happy to be here. And, one of my biggest missions is really helping patients and people that are sort of struggling with fertility to really be informed and to know what to ask when they go to their doctor.
What is infertility?
So the truest definition is a year of trying to get pregnant under 35 or 6 months if you're over 35. Obviously, a lot of different things come into play um, with are you ovulating? If you're not ovulating, you can't get pregnant. So that's definitely something that can add
Food's here.
time to people who are trying to get pregnant. Um, and I think that, one of the important things to remember is you want to know that your body is working for you and getting that checked out, even with your gynecologist, is something that they should be able to do on a simple level.
Okay, and what age should someone start to see a fertility specialist when they're starting to look at going through this process? Should they, if they're having trouble, should they start at about
Meeting is
35?
being recorded.
So I don't think there's a set age.
Excuse me?
Can everyone mute themselves while we're doing this? Thank you.
So I don't think there's a specific age. I think that for some people, more so than ever before, and you can tell by the number of people that are a part of Fertility Warriors, there's just a lot of information out there. And for some women, you feel better going in and checking your AMH and checking your ovaries and checking your uterus and checking your tubes and say, all right, if everything's good, I'd like to check my partner's sperm. Semen analysis is normal. Great. We're going to go try for a little bit. Some people feel better doing that, before they start. But I think that anybody who is in a place where they feel like they're struggling, there's no harm in coming into the office, getting evaluated. And then, sometimes patients are more comfortable being monitored a little bit or, having their hand held a little bit as they're going through the process. And then maybe they don't need that much help. Not everybody needs IVF.
What would distinguish somebody that needs the help in terms of doing assisted reproductive, where I think it's called ICSI? Or we
Sure.
explain a little bit about that process.
So ICSI is something, fancy word, intracytoplasmic sperm injection, where the embryologist really takes the sperm, puts it under the microscope, and it's in a very thick, viscous fluid, so the sperm moves in slow motion. They can select a single solitary sperm, take an egg, and inject and fertilize the egg that way. The truest reason that ICSI is used is when there's a true male factor. So if the sperm count, the motility, the morphology is low to the point where you're not getting pregnant because of a male factor, by doing ICSI, you're able to get fertilization. A lot of times that's the hump that you need to get over in order to then have your embryos grow. definitely there are some doctors that or practices that do ICSI on every single patient. And that, it may be a different style, perhaps. Um, for me, I like not having to do ICSI if we don't have to do it, because you get less manipulation of the egg and sperm. You still are allowing the sperm to fertilize the egg on its own a little bit. But on the flip side, if you do need ICSI, then you do it.
Can ICSI, just to go back to what you just said, can ICSI affect the embryo or hurt the embryo while you're performing that? Is there a chance that, let's say you only have, 4 or 5 embryos to maybe do ICSI on, could that have a negative effect on it or damage the embryo to where, let's say you do get pregnant, there could be side effects down the line?
So when you're doing ICSI, you're dealing with the sperm and you're dealing with the egg. And in the hands of a skilled embryologist, you're not going to damage the egg. Now, you find out a little bit more about the egg when you do ICSI, because the egg has cells around it when it comes out after a retrieval that are then removed. And then you get the a true look at the quality integrity of that egg wall when the needle is going into the egg to fertilize it. So you do get a little bit more feedback. At the same time, an immature egg at retrieval that has a 12 to 24-hour period overnight to possibly mature as it's sort of sitting in the dish with the sperm may allow for a little bit better fertilization. So there's definitely some positives to it, and there's some things that I think that each patient needs to talk to their own doctor about in order to understand, all right, is ICSI something that is right for me?
Yeah.
Is embryo scratch, when they say embryo scratching, is that part of ICSI or that's something completely different?
Totally different. So an embryo scratch uterine scratch is similar to an endometrial biopsy. So that's something different, looking at the uterus to see about failed implantation and see if there's any chronic inflammation or endometritis. You're maybe referring to assisted hatching, where on the embryo, we're making sort of a nick in the outer shell so that the embryo is able to hatch a little bit easier.
Okay, so that will help when, will that help decide whether the egg it's a good egg? Does that?
It happens. So if someone gets pregnant in their body, as the embryo develops, it becomes a full expanding and hatching blastocyst all in the body. In the lab, if an embryo is, let's say, frozen when it's an expanding blastocyst, when we thaw that embryo, we do assisted hatching to aid the embryo to continue the hatching process and continue to divide and grow.
Is PGS testing something you recommend for everyone? Is it really depending upon your age? Do you suggest it for all your patients once they're at a certain age range, or is it really up to the individual themselves?
A good question. I think that I would say across the board, I don't think anything is for everybody. But for screening your embryos, a 30-year-old woman, if we arguably say 8 out of 10 eggs are normal, but at 40, 7 or 8 out of 10 are abnormal, a 40-year-old, I would recommend it slightly more than I would recommend it to the 30-year-old. Some 30-year-olds may want to do it. There are people that could be 28-year-olds with 3 miscarriages, and they want to know that they're putting a normal embryo back in. 80% of all first trimester miscarriages are chromosomal in nature. So if you're able to know that, okay, I'm putting a normal embryo back in, then you're also eliminating 80% of the reason that you might have a miscarriage.
Wow, and that's a high percentage. That's a high percentage.
And that's part of the reason, when we talk about recurrent miscarriage, we discuss, age being a big factor in just that from 30 to 40, more eggs become abnormal over time.
Wow, in that age range.
Yep.
So do you suggest when you're in your 20s, is it becoming more, is it becoming, I guess, more of a thing for people in their 20s to freeze their eggs? Are
I
you
would say
seeing more
that
younger people coming into you, that may not necessarily be getting married or be with a partner, that they just want to freeze their eggs because maybe, they're working and they're starting out a little bit older now?
I think that we're probably a half a generation away from getting the true 20-year-olds that are coming in to freeze their eggs solely as insurance, where they're not looking to use those eggs really at all. They're just being extremely proactive, progressive minded, and saying, you know what? I don't know what I want to do right now. I think I know I want a family, but I want to go to school to further my education. I want to work for a while. I want to start a company, and I don't want to feel extra pressure to find a partner and start a family right away. And that may be at 25. Who knows what you want to do at 25? So if you are able to freeze your eggs, the earlier you do, the better quality and more eggs that you're going to have at that time.
I wish I had known, I wish a lot of this was out there back when I had first started this whole process, so it's so interesting to hear all of this information now, especially learning so much within the group, because I think people are so much more educated about this process than ever
The tech,
before.
the technology now is at a point where it can really make a big difference. 10 years ago, borderline. And so, when someone comes in and they're, early 40s and they're like, wish I could have done this 10 years ago, maybe the technology wasn't really there at that point. Now we know the technology is at a point where you can really preserve your fertility. And then if you do need to come back and use your eggs, you have them there. Um, it takes a little bit of a leap of faith, I think, for someone to come in at an early age before they've really started thinking about this to do it. Um, but we have insurance on so many other things, and this has such a limited time. It's so time sensitive that by doing it, you're giving yourself options.
By how many times, a lot of times I went through 7 IUIs and probably about 4 IVFs. Um, so I really put my body through a lot. Um, in terms of all the medications and the hormones and everything else, should we be careful how many times we actually go through this process? And should we be careful how many times we're taking all the follistim and the estrace and all the hormones? Is there an age that we should stop for the fear of anything else happening medically down the line?
So that I think is an incredibly good, deep, and important question that I don't think honestly there's an answer that is 100% definitive. I believe that the process of trying to have a baby and building your family is probably right at the top of the list of things that are important. And obviously your health is paramount to everything else. And I really just try and tell my patients that it's important to be really proactive with your health maintenance, be it mammograms or breast sonograms, seeing your primary care, getting a primary care, an internal medicine doctor, um, because we don't know what we're destined to have down the road. And is taking hormones for a couple of weeks a problem? Probably not. They're in and out of your body. To do this for 2 years, probably most people will be fine. But in all honesty, for somebody who maybe at age 60 is at a higher risk for some type of cancer because they have a family history, those are people that need to probably be a little bit more conscious, and recommendations for colonoscopy or breast mammograms, or maybe at a certain age, and maybe we do it a little bit earlier, be um, a little bit more proactive, and push to have those done at an earlier time, just to be on top of things.
So recently, someone I know was unfortunately lucky enough going through this process, found out that through one of their testings that they had Hodgkin's lymphoma. Do you
Okay.
find out, are people seeing other issues come across from going through IVF? How can cancer or being um, diagnosed with that affect going through IVF? Can you still go through some of the treatments? Do you have to wait till treatment is over for people that may have just been diagnosed?
So a lot of patients get diagnosed and come in to freeze either eggs or embryos or sperm for men, um, before they undergo their actual treatment. And because, everybody's different, but the oncologists today, the oncology surgeons today, they're very aware that we're surviving cancers. We are um, diagnosing things at earlier ages, and we don't want to do our treatment and then at 35 realize that we can't have a family. And I think those patients are given a decent amount of window where they come into the office, and we're able to get them into a cycle immediately, freeze, whether it's eggs or embryos, and then allow them to go do their treatment and not have to think about this on top of everything else while they're sort of battling things during that time.
Okay, so recently, I actually just started a page for members of the LGBTQ community. Have you started to see an uptick in your number of patients that are from the LGBTQ community? Are there differences in treatment? Um, Tell me a little bit more about how that all.
So I would say that same-sex couples for the last decade or so have been coming in. I think that the information is out there now, which is amazing, that you realize that patients are coming in with a lot more knowledge. They know,
Right.
okay, my wife and I need to get a sperm donor, and our friends did this, and what makes the most sense for us? I want to carry, but my wife doesn't, but she's going to go through IVF, freeze embryos with our donor sperm, and then I'm going to carry that after I have my baby first. There's a lot of
Oh, it gets a little
incredible,
technical, right?
but you have a little bit more options in that sense. I would say in the last year or so, there's definitely more transgender patients coming in, looking to freeze before transitioning,
Oh,
before taking
interesting.
medication to start that process. Um, and you know what? I think that that sort of being all encompassing, for me, it's it's at this point, it's so common that it's there's no difference. It's someone who is using donor sperm, or it's a heterosexual couple. There really is no. It's so common that I think that it makes everybody more comfortable, because it's not anything that
Different,
new or taboo anymore.
right?
It's every day.
When using donor sperm, there are so many different companies out there. I know when I went through the process, I went through Northwell. Um, but I know there's so many zillions of companies and places to go. What do you suggest when you're looking at at a donor program? Are there things to look out for? Are there things to stay away from?
So I think that you want to go to a reputable sperm bank, and that cryobank, California Cryobank, Fairfax, those are two of the biggest ones. Doesn't always mean they're the best, but they do a lot of the weeding out that maybe some of the smaller ones don't. And I think that you really need to just get your genetics tested so that you know you're selecting, let's say, a sperm donor that's not a carrier of the same disease. That's probably the most important. I know that um, there aren't a lot of there's not a lot of donors that work for everybody, and so that can be trickier. If you're looking for an African American donor, you can be really limited, and that forces you to maybe go to other cryobanks that maybe not as many people have heard of, but are just as good, and they're doing the same testing. So I think that you know it's and when patients first come in, we often will say, you're doing that on your own to a degree. You set up your relationship with the sperm bank, you select your sperm, and then ultimately you send it to our office. But I do think that most, or at least, in our office, we want to be as helpful as possible. And so if you need a little bit more assistance, we're going to be helpful and help you look into, is this donor okay for you? Does it match up appropriately? The characteristics that work for you versus somebody else, that's all individual stuff.
The privacy aspect of everything now with 23andMe and all the, ancestry and all the genetic companies
Yeah.
that are out there now. Are there any dangers with that? I mean, the nervousness when picking a donor that down the line things can get out? Are there protections, or is it really just a chance people take now with all these services that are out there?
In theory, you're supposed to be able to select an anonymous donor. You can also, that donor, when they go in there to donate, are able to select that at age 18, the child can find me, I'm willing to be found, or no, I'm going to stay anonymous. Um, that being said, there are a lot of people that, especially single moms by choice, who want maybe to be able to use a sperm donor that is open, and then they can find the half siblings, and a lot of them speak and get together. And I think there's different sense of community. We're creating families now more than ever before in
Whatever.
different ways,
That's
and I think we have to be careful, and at the same time, take some pride in the fact that there are so many different ways, and we are trying to be as inclusive as possible. But again, the anonymity part can get trickier, especially for those who do want to maintain their privacy. As
when
far as what we do in the
Right.
office, that we maintain it. The sperm banks and what those those different levels and barriers are different.
when doctors suggest you have to go down the donor route to their patients, a lot of times people get very disheartened when they hear that right away, especially if it's their first consultation. Oh, I think your best route would be going the donor route. And I know when I first started my very first consultation with a doctor, that was the first words out of her mouth. And I remember thinking, I kind of felt a little deflated, like I was still only maybe 38 or 39 at that point, probably about 38. And I just remember thinking, maybe I don't have a chance. Like it didn't give me a lot of hope right off the bat. Do doctors say that because in reality, when you get to that, say that age, that you're pretty much 90% going to go down the donor route? Should
I,
we not be
I think
offended?
I think it's something I learned, I think, in my first or second year in practice. And there was a woman, and I used to not even bring up the donor egg option because the cost was so prohibitive that, and it's still very expensive, but I just felt uncomfortable bringing up a $30,000 option when it just seemed so it seemed crazy. And I brought it up to this woman, and she was very offended. And like you said, and
Mm.
she came back about 5 years later and did donor egg and had a couple of children. And she pulled me aside and she was like, I just wasn't ready to hear it. And I think that for me, my feeling is if you have a chance to get pregnant with your own eggs and you're informed and you're you're taking everything into consideration. And I think sometimes, you know, maybe we don't always factor in insurance coverage or somebody who doesn't have insurance. And if you have one shot to have a baby and your chance of an IVF cycle working is 3%, and you have $20,000 to spend, or you could move it over into the donor egg column where you have a 75% chance of getting pregnant, it's a humongous difference. Um, that being said, there are patients that come in first visit and they say, "Hi, I'm here. I want to do donor egg." And those are people that have already arrived there. There's nobody, I don't think, that, woke up and said, "I can't wait to do donor egg." That's not my first or second or third choice. Once you're at a point where that really is the option, then it depends if you and your spouse are on the same page where you're okay with it. Because if you're not, then it's not an option. And then you just have to say, well, what can I do with my own eggs? And what's reasonable? My whole thing is I don't want you just spinning your wheels. If we're not able to make any progress at a certain point, it's a lot on somebody mentally. Physically, we can take the hits, but mentally, it's
It's a
just a
lot.
lot.
No,
And so I think,
it's a lot to deal with, especially from a patient, from me having gone through that myself.
yeah,
I know emotionally the toll that it could take, the the ups and downs, for everything. So I'm aware of the toll that it really can take on you emotionally and your partner emotionally, going through it, especially financially. But
and I
now
and I
more
and
than,
I
yeah, go ahead.
I think that you have to find somebody that is hearing you, and you should be having a conversation that is ongoing with your doctor. And at a certain point, the doctor knows what your intentions are and what you want and what you're comfortable with now. Over time, things may change, but there are people who get married at 42. They don't want to, they haven't even had sex 10 times. They want to try and get pregnant. And so with their partner, maybe. And donor egg isn't even something maybe they knew existed. So I think that some people may push donor egg because it's easier for them, um, but it may not be easier or best for the patient.
Especially if they're not there yet in their own mind. Because I really think you have to be there psychologically,
Yeah,
which is why I think having a therapist going through this whole process is so vital, in my opinion.
huge.
And having support, whether it's our support group, Fertility Warriors, or anywhere else, to have the support going through this, because to me, just being listened to, and knowing that I wasn't alone going through this whole process, which is one of the reasons why I started the group. Because, years ago, there really wasn't many places to turn to.
We used to have either a social worker or a psychologist come in. We'd have some flyers up, and nobody wanted to come in. Nobody would come. One person maybe.
Right.
And you know, it being at least initially online and through social media and with really a community with fertility warriors, you can still, if you choose, maintain your anonymity, but you're really able to connect with other people that are going through the exact same thing. And I think that it's incredibly valuable to know that people are going. So look, people, when you go to the doctor's office, you know that sometimes it seems outrageously crowded, and there are doctor's offices that are like that every morning. And there are a lot of women that are trying to get pregnant and are struggling with it. And to at least know, all right, I'm not alone. I'm not in the corner in this dark place by myself, I think
Wow.
is the most important thing that helps you get through the process.
Yeah, absolutely. And to know that you can ask questions and know that Nobody's going to shame you for what you're going through.
No.
The other question I wanted to ask you is about illnesses that can possibly contribute to infertility, whether it's being overweight, thyroid, fibroid, any issues inside. What are the things that can directly contribute to that?
So anything that is going to distort the uterus, fibroids, polyps, scar tissue, anybody who has had any surgery on their pelvis at any point is at risk for their fallopian tubes to be blocked. So again, it comes back to a really good initial workup, and even just the history. When you're taking the history from a patient, you're able to the doctor should be able to say to you, your doctor would say, oh, you had your appendix out. That's right near your right fallopian tube. Let's do a hysterosalpingogram and make sure your tubes are both open. Um, illness wise, we're constantly checking on the thyroid because we know that has a big impact. But the autoimmune diseases really are a tricky piece of the puzzle right now that we
Interesting.
deal with. Obviously, patients with Hashimoto's thyroiditis, or believe that there's some autoimmune component just to endometriosis. Obviously, the rheumatoid arthritis and lupus; those are a little bit more obvious ones, but that really does affect embryo implantation, um,
Inflammation.
inflammation in such a great way that that's become a big focus of trying to combat that on top of everything else we're trying to do.
Wow. So there's a lot of factors, key factors that go on when preparing. Is there a test when somebody's first starting on this journey? Is there one test that somebody takes to kind of get an overall picture of their health, of their fertility health?
I think, I mean, your AMH level, your anti-mullerian hormone level is something that everybody should know.
And that
And
tells you everything about.
that tells you the age of your ovaries, how many eggs you have left, how close you are to menopause, how many eggs you might make if you were looking to freeze your eggs, how many eggs you might make if you're doing IVF, how much medicine you need if you're doing IVF. But if you think about anything that you do in life, you have information. If you were, I'm going to use two really bad sports analogies. If you're a golfer and you are really, really bad, you're not going to expect to play professional golf. You're going to know what your score is on average. You're going to know your bowling average before you step into a league, so you know where you fall. You want to know where you are before you start this journey. Your OBGYN can draw it, and they should. They could draw when you're 25, because what if your ovarian reserve, your egg reserve, your AMH is lower than it should be? Well, you weren't thinking about getting pregnant for a few years. But if that level is going to continue to go down, by the time you're ready, you might be in a position that you really don't want to be in. But if you check your level, you know you're in a good place. You check it a couple of years or a year later at your annual visit, you sort of really, it's almost preventative care for fertility. And I know some patients will come in and they've done IVF 3 times somewhere, and I'll say, do you know what your AMH is? And they're like, no. And I feel like you don't need to know everything, but you want to have an idea of the important basics, because it's your body, and it is something that's telling, and it is something that does impact your success.
Okay, a couple of quick questions before we end things. I want to ask you a question about uh, people with medications, and a lot of times on sites, I know on Fertility Warriors, I don't allow the sale or donation of meds, but I know that that happens in a lot of other sites. What's your take on that? To me, I look at it as a liability, because I think if a medication is damaged or if it wasn't being taken care of the right way, you're really taking a chance on something that's a very big financial deal, going through fertility.
So I would say that it's a liability. Um, if you have a friend or a family member who's going through it and they have extra medication, obviously maybe that's a much better source than meeting somebody in the back lot of Target. I think that it's just unfortunate that we have such differences in insurance coverage. New York State is slightly getting better, but it's not the best. And the medications, it's obnoxiously expensive, and there are only a few. There's only a few companies, and so we're limited as far as what we can use. Um, but obviously, you don't really want to take open medication that from somebody you don't know. I understand why people do it. Um, I wouldn't say you should do it, but I definitely understand why somebody would.
Smoking. I know we've talked about it in prior discussions, but now that this is national in a way, tell me about your viewpoint on smoking while pregnant or smoking while going through the beginning stages of your fertility, meaning you're just starting out taking your meds. Is it okay if you're a cigarette smoker to continue smoking? Can that have an effect on your
No,
fertility? Or
it's
is it
not
okay
great.
to smoke while pregnant? Some
No,
members have said in
no.
the past, oh, I've smoked and it was fine. I want
Listen,
to hear
or
it from you.
no. I mean, I am very open to and liberal, but you should not smoke when you're pregnant. Um, yes, people have done a lot of things. Did my mom smoke when she was pregnant? Probably, you know, but it doesn't mean that that's a great idea. And it's definitely linked with prematurity, and it's overall unhealthy to smoke, especially if while you're pregnant. Um,
Marijuana. What about smoking marijuana? It calms
I
my
would
nerves or for nauseousness. Now people said, oh, my doctor prescribed gummies. What's your opinion on that?
I would say that smoking in any capacity, marijuana, cigarettes, vaping, while you're pregnant is a no go. I, you know, if you're at a wedding, can you hold a glass of wine and have a sip or two? Nothing's going to happen. But if you say sure, someone else may drink 2 bottles of wine. Um, I think that especially in a community like this where you're working to get pregnant, I don't see a lot of patients that are smoking, especially once they get pregnant. It's really hard to quit, and they'll work towards quitting and know, like, all right, once I'm pregnant, I'm gonna stop. But most aren't. It can affect egg quality. It definitely affects sperm. Um, I'm not so comfortable with even marijuana gummies during pregnancy. I just don't. I don't see the benefit to that. I can understand the feel good benefit to it, but I think overall, I don't know if I would tell you that that's anything that anybody that I know would recommend.
But before we end this discussion, are there any tips you can give people that are going on this journey or throughout the journey, what to look out for, what they should be doing to give them a little bit of a leg up on things?
I think the most important thing is finding either a doctor or a fertility center that you feel comfortable, you feel heard, and listen. It can be busy, but you still shouldn't have to feel like you're just a number. And if you do, there are, especially in most big cities, there are other options. And I think that, you know, once you go and get yourself at least evaluated with the basics like we talked about, then you can start really trying to get pregnant. And you don't need to be doing a basal body temperature every single month, so that every morning you wake up, you have to take your temperature and you're reminded what you're doing. If you did it once, it tells you that you ovulated. Great. Now you're going to move on to an ovulation kit that's going to tell you when you're going to ovulate, so you know when to try, and you want to allow it to happen. And if it's not happening, then you find a place that can help you, because the goal is to get into the doctor's office and then get out.
And that's the goal for everyone. Dr.
Yeah.
Trivax, I want to thank you for joining us. We're so excited that this is our first national interview, and to have you here. You are empathetic. We love you. Um, your patients speak so highly of you. So I really appreciate your time in speaking with us tonight. Hi, I want to welcome everyone to our Tuesday talk with Dr. Bradley Trivax. Dr. Trivax, welcome to Fertility
you.
Warriors. How are you?
Good to be here.
Well, thank you for being here tonight. First of all, I want to welcome you. This is going to be our first interview that will be on our new YouTube channel. So for our national audience, please tell me a little bit about yourself.
Sure. So I am double board certified in obstetrics and gynecology and reproductive endocrinology and infertility. I'm part of Stony Brook Medicine's Island Fertility. That's where I practice in Comac on Long Island. I've been really working in the field of infertility for about 15 years. Um, and I'm really happy to be here. And, one of my biggest missions is really helping patients and people that are sort of struggling with fertility to really be informed and